For those of you who don't know me, my name is Barbara Senich. I'm the head of our marketing and business line management group at PDR. I spent most of my career on the pharma side in primary care and specialty care marketing at Merck and Roche, and I spent a bit of that time at Medco, PBM as well. But like many pharmaceutical marketers, I started my career carrying the bag, talking to physicians and listening to them. I remember that you had to do that as a good salesperson. And then I moved into headquarters in market research, which again is just a bit more formal way of talking and listening to physicians and other customers. And as a marketer, moving on in my career, I really learned how important it was to use market research and data to help inform your decisions and your business strategies, your marketing strategies. Market research doesn't make decisions for you. I've always said that. But it really does help inform those decisions in a lot of good ways, and it helps you think better and sometimes even differently about your challenges that you have and the opportunities. I'm joined today here by Vita Larkin. She's one of the market researchers that I've had the privilege of working with during my career. She comes to us from Vital Market Research. She has broad therapeutic experience, both primary care and specialty care, and she had held a number of U.S. and global marketing research positions in leadership roles at Roche, Novartis, and Forest. And she has done consulting since she left those companies for a number of companies, including Pfizer and BMS. And that's been in the area of primary research, secondary data analysis, and forecasting. So I'm delighted that she's with me here today. We're going to both present some of the the information that we've learned in the past 18 months or so from our customers. So we're going to be sharing what we think some of the frontline learnings are, if you will, from communicating with physicians in the EHR. So about at the beginning of last year, we started our work with conducting a large number of in-depth, one-on-one in-depth interviews with our customers. These are great because you really can not just say, what do you do, but you can ask doctors why they do it. And we wanted to learn what they were doing, how EHRs were changing their practices, but most importantly, we wanted to focus on what they needed from us when it came to drug information. We complemented this work with some larger scale surveys, which we can do in a number of ways, most particularly using the PDR database, which has about 600,000 ambulatory care physicians in it, as well as other venues such as our EHR vendor partner user conferences, where we're also able to talk to physicians and their staffs. And then more recently, we've begun a program of in-market testing of our EHR communication services to understand how physicians use our tools and how they can be optimized. And we've also used some of these approaches to help inform our development moving forward. And so just one, almost a quick as an aside, we have also taken, I mentioned the database that we have, we've also embarked on a project late last year to identify the EHRs that are used by those 600,000 doctors. So it can be, one or two in the ambulatory care setting, and then whatever institutions they may work with. So we're about halfway through the project. We have information on about 300,000 physicians by name, and we keep that. And we're going to be using these data in a number of ways, including customizing physician education, more market research, and various types of sales support. So, that's a work in progress, but we're going to continue to leverage that as we move forward. So I'm going to turn it over to Vita to share some of our physician landscape and some of the key learnings that we've had from our physicians in the past few months.
Thank you, Barbara, and good afternoon, everyone. First, I'm going to be talking about, I'd like to take some time and reflect on the physician landscape. We've talked a little bit about that today, and what I'm going to show you is what we've learned when we've talked to physicians in the series of research projects that Barbara just outlined. So first of all, just looking at an outline of what EHR doctors look like versus their colleagues who haven't implemented EHRs at this point in time. From a demographic perspective, EHR active physicians tend to be a bit younger. They're more likely to be an internist or a family practitioner, or sort of the internal medicine specialties, the larger ones, the cardiologists, gastroenterologists, endocrinologists. And as you might expect, they tend to prescribe a little bit more than their non-EHR colleagues. From a practice type, they come from larger practices, larger group practices that happen to be in more urban or metropolitan areas. In terms of their drug information consumption, compared to those without EHRs, they see fewer drug representatives, and they use technology and mobile particularly more actively. Interestingly, they do engage with patients more, and they use technology to communicate with them more frequently, but still, like their non-EHR colleagues, they still like to print information that they give to their patients. So that's currently what they're doing, and we see that evolving perhaps in the future. So this is another thing that you've sort of heard a lot about today. So we embarked on a series of qualitative in-depth interviews to understand what the day in the life of a physician might be in relation to how they work with their EHR. And we wanted to understand what they do, how they do it, and most importantly, why they're doing it, and where the EHR fits into their practice. So for those of you in pharma who are familiar with buying process research, which we all sort of do when we take on a new brand that might be new to the company or a new therapeutic area where we don't know much about, this research was done in that same spirit of the buying process research. And we asked doctors to describe to us in a typical day all the ways that EHR touches their lives. So we heard sort of the feelings towards EHR ran the gamut from those who are very enthusiastic acceptors to those who are grudgingly resigned to the fact that this is their new life now and how they're going to have to practice. But they all noted that really they understand this is the mainstay of part of their practice now. So some, and I don't know if we were the originators of this information, but in this research, the physicians did impress upon us that the EHR for them is analogous to us as a business person, the way that we use Outlook in our daily lives. And even though teenagers don't use email, I think when they put on nice clothes and get up and have to get up and go to a job every day, they're going to start using email. So even before they sort of, when they wake up in the morning and they're home and they're drinking their morning coffee, physicians will check into their EHR to sort of anticipate what their day is going to look like. And continually throughout the day, as they're seeing patients and as they're managing their practice, they're touching the EHR all the time. I think as Dr. Golub commented, many of them say that it's slowed them down and it's distracted them from the face time with their patients. But others do say that they really do feel that it's made them more efficient in their day as well. So there's certainly a spectrum there. So like all of us, physicians navigate their daily professional responsibilities and they have to deal with challenges every day. The ones that they deal with a lot of the time is, as all of us as well, they're under a severe time crunch. They know they're not able to spend extra time with their patients that they might want to with regard to educational or treatment guidelines or things that they might need to do to increase the efficiency of their care. They are hesitant to own some of the administrative tasks that have been put upon them. They see that as a burden, and they see that as someone else's responsibility that has now been thrust on them. But that said, they do see the value in providing patients with additional materials, with take-home education, or with helping them in the financial burdens of their treatment, because they understand that it increases treatment's effectiveness. So they reflect a little bit of ambivalence between wanting to do it and knowing it's the right thing, but the challenges of their daily lives make it a little bit more difficult for them. So they're struggling with this technology, as we've heard today. They're cognizant of the time that they're facing the screen versus what they're facing the patient. They're unsure of, and they're wary of appearing unsure in front of patients when they have a question or when they need to go into the EHR, they want to dig a little bit. So sometimes they'll leave the patient room if they have a question like that. And when they want to get information very quickly, they need it to be quick, accessible, and it needs to be the right information. As we've also heard, you know, if it's too many clicks, it's going to just bother them, it's going to frustrate them, and it's going to add to their burden. And many that we talk to are still wary of communicating with their patients electronically. They're concerned, as I talked about, with the administrative burden, but potentially also the liability of two-way electronic communication with regard to patient treatment. But some of them are using a patient portal, and they're indicating that if the patient portal is to be effective for them, that education would need to be something that would require less physician involvement as opposed to more physician involvement. They really expect patients to start taking more responsibility for their own health. So with that as a framework for the physician's mindsets around the EHR, we wanted to dig a little deeper into the tools and services that might help physicians be receptive to communication. And we recognize that when it comes to communicating with two physicians, one size doesn't fit all. Every time we speak to physicians in research, we delve a little bit deeper into how they're using technology and what they want to get from it. And we have some themes that we hear consistently across different levels of experience. So two segments seem to be emerging. It's those acceptors of the technology who really who are enthusiastic, who see it with eyes wide open and have a positive intent towards the technology. Interestingly, these are the physicians that actually have very high expectations of the technology, and they want the technology to help them get it right, and they're open to that. Then there's others who accept it just really begrudgingly and may only be using certain parts of the technology that they feel comfortable with. The enthusiastic acceptors engage immediately with it when we talk to them about things that they might want to improve or how well it's going. They really give us thoughtful critiques. And then when we talk to those who struggle and might have a bit of a negative outlook on the technology, it's interesting to talk to them and understand what their workarounds are for them to try to make it easier for them. We sort of figure out what the problems are by figuring out how they work around it. From a patient engagement perspective, as we talked about, those who are enthusiastic tend to use the technology to facilitate the conversation with the patient. They use it in the room with them. They engage the patient. They let them know what they're looking at and what they're doing. And others really feel like it hampers that communication and that relationship. And then, as we talked about today, everybody wants it at their fingertips at the moment. They want the technology to be easy. They want it probably only to use it when they need to use it with regard to communication, particularly with treatments that they use less often. So we've seen this slide earlier today when it comes to communicating with physicians, and the considerations that we have to take into account when it comes to workflow allows us to sort of take into the consideration what we need to think about when we're trying to develop communications that meet the needs of a range of physicians. So the key success factors, we know that the content needs to be valuable and clinically relevant. We know they want it in workflow, they want it at the point that they need it, but they also want to control when and how they view it. They want it to be intuitive, and it must be from a trustworthy source. We also know that they do not want this to appear as if it's influencing their prescribing in any way, and so that's something that we have to avoid at all costs. And while they have some tolerance, it's small for allowing the sort of promotional language of, say, that they would get if these messages were coming from a sales representative. So while a lot of these factors are within our control, some aren't, and we just need to stay cognizant of them as we develop our communications to physicians within the EHR. So we've also seen this slide before from a syndicated study which shows that 2/3 of physicians are interested, in fact, in accessing pharma content and features in their EHR. In PDR's recent physician engagement survey, we see a strong interest from physicians in having drug content that is up to date and FDA approved. Over 80% of physicians think that that type of information is important, and they do want it in their EHR. So again, with this as a background, as we're building our knowledge base, we decided to go to physicians and ask them to evaluate a full range of specific concepts for communication within the EHR, to better understand very specifically what their preferences and priorities might be for any way that we would want to communicate with them in their EHR and very specifically while they're e-prescribing. So from an even longer list of potential features than what you see here, we identified 25 concepts that we took into in-depth patient interviews with physicians last fall. Some of these included ways to present and access full drug prescribing information, patient coupons and copays, various brand messages, treatment guidelines, and even controlled substance monitoring tools. Each physician was exposed to each of the concepts. We asked them to rate it in terms of how much value it would provide to them, and then also asked them how it might be enhanced or improved upon if we delivered it to them. So this is then a representation of the results of what we found and what physicians told us regarding which of these concepts were rated more valuable versus less valuable. The concepts in blue represent drug information and safety tools that we might provide to the physicians. The concepts in green represent patient support services, and the concepts in whitish gray there represent physician tools and messages. And as you can see, the drug and safety information was deemed most valuable, more valuable, and they reported that they wanted the full prescribing information, but there was a caveat to that. As long as the full prescribing information was quickly and easily accessible to them. So they just didn't want to see the whole full drug label. They wanted to see the part of the drug label that was most relevant to them in that situation with that patient at that very moment. So they want us to read their minds. In addition, dosing information was also very important, and again, caveated to a very strong desire to see what they want themselves, how they personally want it. For example, pediatricians wanted to see weight-based dosing because that's very important to them, or a lot of physicians wanted to see dosing with regard to how it changes for renally or hepatically impaired patients. So those kinds of customizations were important to these value scores that they were providing this information. And the patient financial support services also were very strongly valued by physicians. So confirming this qualitative research that we just did, we asked a larger group of physicians at 3 EHR user conferences sort of a similar question: what types of drug information would they most want to see or need to see during a patient consultation? And physicians across the 3 different EHRs told us that indeed it looks like dosing, patient education materials and safety information would be most often used and desired. So again, besides sort of the benefits that we've already talked about, we wanted to understand about physicians, more about what the benefits of having this drug safety information accessible in the EHR, how it might benefit them. So physicians have told us in our EHR engagement survey that they anticipate saving anywhere between 5 and 30 minutes a day if this information is easily accessible to them in their EHR. And while they may not access this information with every patient or with every drug, however, if they need it, when they need it, they want it at their fingertips. And so with that in mind, we wanted to explore in some detail how physicians would in fact use brief to answer a particular set of questions that might naturally arise during a patient visit. So we adapted the traditional time and motion study methodology to an EHR environment. We piloted this study on a small scale to test the methodology as well as the hypothesis that, could brief in fact save physicians time. And what we found was that physicians use various modes of information when they need to research a drug during a patient visit. So we heard they heard that there are applications in their EHR currently that they use, or they use their smartphone, or they left their EHR and they used Google or the internet or a manufacturer's website. About a third of the time, physicians went outside of their workflow and used Google for the tasks that we asked them for in this particular study. And what we found was there is an opportunity, certainly, to streamline. So of those, when the physician used the Google task, and then when we asked them to complete the task using brief, they actually reduced the number of clicks to get to the same information by 65%. And twice as many physicians were able to find the critical safety content that we asked them to find, REMS content, for example, by using brief as opposed to the other method that they might be normally using today. The other thing which was encouraging for us to hear was that providers find it easy to use. They thought it was easier, they thought it was painless, and they thought that it wasn't as labor intensive maybe as what they were currently doing. So as we said, this is a pilot. We anticipate scaling this project up to a larger, maybe more projectable sample, and there'll be more to come on this. So with that, I'll hand it back over to Barbara.
Great, thank you. Thanks, Vita, very much. So, with this as background, the natural thing for the marketers in the room is to want to know, say, well, given this, yeah, right, this is, there are different segments among physicians with differing needs, there are different types of EHRs, it's a little complex. But given this, how can I best get my messages across to the physician? And we have that question, but we also have to answer the question here at PDR, how can we do that while creating that right balance of accessible drug information and brand-specific support? And so, throughout all this research, I think as you've seen, the doctors have indicated that they are receptive to pharma-sponsored information as long as it doesn't seem like it's too much. And they often use those words. And in brief, they tell us, and literally, this is what they say, they will give us the right to bring pharma-sponsored information into their EHR as long as we've done a really good job delivering that full drug prescribing information in a way they can access it easily. They're smart consumers, obviously, of drug information, and they'll use it as long as it's helpful to them. So naturally, one of our questions was how much is too much when it comes to delivering pharma-sponsored content? Just like marketers devote a lot of time and energy to optimizing visual aids and detail pieces, we've also embarked on a similar process with our physicians to optimize communication. And this was just one of the surveys that we did recently. we found that 70% of our physicians would welcome pharma messaging in the format of PDR brief, as you see over on the left of the screen. And 10% would welcome both brief and the advertising visual that was represented to the right. And then 20%, obviously the missing group, said they would prefer neither of those. So at least in this case, we took away that, the brief is pretty useful there, with 80% of physicians saying, that they certainly find it acceptable. But there was a preference a little bit more towards the more staid representation rather than something a little flashier. So just, it was starting to give us a glimpse into this whole world. And so in order to build on that, we want to sort of take a look at saying, okay, what does this mean for actually messaging in our communication vehicle in brief? What specific words and visuals will motivate doctors to access that information? And so we started this process by conducting our first message test here, where we're just really, it's not about drugs at all. It's about messaging, about learning more about PDR brief. And so there's message 1, you can see on the far left on the top, which is a plain vanilla message. And then message 2, we kept that message and then added an icon. And then we said, okay, well, what about a slightly jazzier message, something a little more promotional? We did that, and then we took that promotional message and added the icon to that. And so just wanted to see how they performed. And as you can see from the first message, the plainer message, clearly the icon generated 75% more activations and interest than the plain text. So, pretty interesting and striking difference. And then going to the second one, the promotional language plus the icon essentially is 190% better at generating activations than the plain text, than the absolute plain text. So again, tells us that clearly messages may perform differently, and that as we move forward, understanding how your messages perform and what the right balance is will be certainly a very important part of the work we do together. And then this is another test. So we said that one, so let's test some other things. And this is still underway. We haven't read the final results yet. But we wanted to see how a graphic image, because we have the capability of putting some graphic images into brief. And so we said, all right, we took the plainer message on the far left. We kept the same message and added an icon, and then made it a little more jazzy with the visual. And you can see here, adding the icon, again, made the actual message perform better, 160% versus plain text in brief. And anybody hazard a guess about how the image performed? I won't keep you in suspense. It did perform better than the plain at 116% versus the plain text. But clearly the one that performed the best was the icon. And so, the one on the far right, message 3, might start to be an example of maybe where we're, how much is too much? Certainly not the final answer on that, but certainly something we're going to keep looking at. And so I think, as we alluded to all of the research earlier, doctors have told us we earn the right to bring your messaging, the pharmaceutical messaging, into their EHR if we give them high quality, clinically relevant prescribing information the way they want it. And literally they said, you really need to start reading our minds. So in lieu of that, we've sort of set some objectives for ourselves in doing some work, which I'm going to describe in a minute. Clearly, they've told us they want this information integrated in their EHR. They want it up to date, label, really accessible. I want to get what I want quickly. They do want some adaptability. They don't say they need it customized, because they probably wouldn't take the time to customize it completely, but they do want to be able to understand what they need for special populations, special dosing. Again, not too much advertising. And believe it or not, they tell us they want it to be cool. So, we figured, this is not a problem. This is an easy task. So we embarked on a project that you can see, it's a little gold diamond says we are here. We're not done yet, but our objective is to find go to the next level of providing the best quality drug information experience to our physicians. And this is really an R&D project. And so this was an iterative process where we design, go back to our customers, talk to them, design again, go back, mesh the best ideas, test again. and really get to what we think is an optimized view from a prescriber perspective. And what you see, the depiction here is just really the front door into it. I mean, I'm not going to go into all the details of what's behind that, what we think are the cool elements, if you will, because it's still a work in progress. But nonetheless, it was a very exciting approach. Now, obviously, once we get this, we also have to then say, okay, how does it best appear in the various EHRs? Because EHRs have different styles, different integration approaches. So we're going to have to do that work as well and then test it again. Just as an aside, you might think these bright colors were, look at these and think we're a little bit crazy. We did offer the doctors a range of choices, and in particular, very, I'll call it, white, largely white with a little bit of color accents version. The doctors were uniform and strenuously supportive of this more colorful version, which was interesting to us. Now, this is, again, still qualitative research, so don't think this is final. But it really was interesting. They said, look, if you'll do it this way, it'll pop and I'll see it. And they wanted to see it. By the time they had looked through it and worked with it, they really wanted to have it and they wanted to see it. So right now, what I want to do is just play you a little video of some of the responses from our customers. Let me see if I can get, oh, there we go. Whoop.
Okay. It makes your job easy because everything is right there.
I like the fact that it's very simple.
I think it's really easy to use.
So I think this is a better tool. The reason I say that is that everything is in one area and easily accessible with a button.
It will be ideal. It's like I don't have to get out of the patient's chart.
If it's built into the EMR, I would tend to use it more.
We always need to see patients very quickly. And so to have these things at our fingertips and be able to navigate very quickly rather than going all over the place is definitely a benefit.
You can do it all within the chart, still all on the same page, so I think it's very helpful that way.
And for the most part, they're able to review their medications, what they're taking. It's written there.
It was superior to what I do right now.
The better tools that I have seen in comparison to what I have used in the past.
It would save a lot of time.
That will save me time.
So it avoids looking into a different one. It avoids opening up a new window, which is going to take up time because we are always on the move.
It takes, I can't do it at Hippocrates. Like Hippocrates doesn't, I can actually show you. If I look up Chantix at Hippocrates, it's not as clear.
If it's easy enough to use, if it's fast enough, then it's one less step for me to have to do.
It would replace probably UpToDate and both Hippocrates.
So I think this is great actually, because it's very clear. I think this is actually very helpful. So if you're distributing free copies of this, I would definitely want one.
Great. So clearly, with full transparency, there were 2 physicians out of the group, the 25, who were not quite as positive, had some other things to say. But inexplicably, their video was corrupted, and I couldn't include it in this video. So you just have to forgive me. The point here is, obviously, feedback of all kinds is good in market research, and that's what we're trying to do, is to get to a better solution. It did impress us, though. This was fairly representative of people's enthusiasm. And again, remember, they were just going through prototypes. These aren't fancied up versions. And so what that means for us is that we are motivated to continue this work and think we're approaching, or at least coming upon, what I think are some better solutions to really meet their needs. And so, while maybe we haven't quite cracked the code yet, I would say so far so good. We're giving ourselves a ability to continue to work on this, and then ultimately take the best of what we've got and optimize it for all of the various EHRs. And before we close, I just wanted to share with you some of the research that we're developing really at the moment. You've heard physicians are very interested in giving information to their patients. Today, most of them say, I want to be able to print it or have someone in the office print it and give it to the patient. But clearly, over time, this is going to the portals. And so there's no doubt about that. And so as we develop our offering, PDR Plus, which was alluded to earlier, we really want to answer what we think are some very important questions. What from a prescriber perspective, what do they want their patients to receive automatically so it just goes and doesn't create extra work for them? And then what kind of feedback do they want, from a patient, from an outcomes perspective, that sort of thing. And my sense is that there will be physicians who will have different views on that, so we are going to have to respect that to further implement the product. And from a patient's perspective, what do they need to ensure that they'll start a new therapy? I mean, that's such an important moment. You just got diagnosed with a new condition, and someone hands you a medication or tells you they're prescribing a medication, and you've got to decide if you're going to go to the pharmacy and pick it up. We want to really be at that. That's a very critical juncture, and we want to do the best we can. As a pharmaceutical marketer, I always wanted to be right at that juncture. And I never could, because I could only do all my adherence programs once the person got their first prescription filled. And this is a chance to really impact that first fill rate. And then from patients, what do they need to make sure they'll stay on therapy, remain committed to their therapy? So, clearly, from our perspective, we want to do as much work as we can. You know a lot about how doctors and patients talk together about your drugs today. What we want to do is say, how is the EHR going to change that patient-physician dialogue, and then what can we do to support that in workflow? So just to sort of conclude, I think the themes that we saw throughout all this research, and again, we just tried to pull the highlights out for you, is that from a drug information perspective, they want up-to-date and accessible drug information is really important, but the doctors have to be able to get to what they want easily. Pharma-sponsored information can ride along with that as long as it's of high quality. Most want to be able to print for patients. Some physicians even said, we're going to show stuff to patients even in the exam room if it's available on the EHR. And then patient financial support is really attractive to most doctors. But again, there's different segments. Some say, yeah, I like handing it out. I like talking to my patients about that. I feel good giving them something to ease their financial burden. Others say, I'm fine if they get it. I'm happy for them. I don't want to do it. That's not my job. That's someone else's job. So again, they're supportive, but we have to probably think about two different approaches to workflow. And then, like most good market researchers, there probably is more work needed. Again, optimizing our solutions for the various EHRs, and then understanding really how to support that new patient-physician dialogue in workflow. So with that, I'm going to conclude, and maybe we can have time to maybe just a couple of questions, but I don't want to extend this too long. Vita and I will both be at the Wine and Cheese, so we can talk to people privately if that's helpful as well. Any questions? Okay, it must be getting late in the day. Okay, thank you so much. Take care.